Good morning, folks. Welcome to Friday's edition of our ongoing town hall meetings. A few things to cover today, but I'm going to start off with something great, and that is I want to reach out and wish Lenore Marks, Mrs. Marks, happy birthday from your daughter, Judy. It's Mrs. Marks' 97th birthday today. So, how wonderful is that? Mrs. Marks, happy birthday, and I hope you get a chance to celebrate it a bit in your own way today. I know that you'll get a lot of warm wishes from the folks that are watching this today. Going into one of the questions that I've been getting lately, and this has come from what's going on in the media right now, is should residents wear masks? Should you wear masks when you're out in public? And there's, it's in the media the last 2 or 3 days about a lot of different opinions on that. And so just today, just this morning, various agencies and people came out with their opinions. I actually have them here. I just pulled this off of CNN. And so depending on which news agency you believe, which news agency you follow, I'm going to read a few opinions. So first it says from the U.S. Centers of Disease Control and Prevention, they are saying, and this is today, they recommend that if you're not sick, you do not need to wear a face mask unless you're caring for someone who is sick. However, if you are sick, you should wear a face mask when you're around other people and before you enter a healthcare provider's office. So that's from the U.S. Centers of Disease Control and Prevention. From the World Health Organization, again, just today, they are saying the World Health Organization is standing by its recommendations to only wear a mask if you are sick or caring for someone who is sick. Mask wearing by the general public is not among World Health Organization's recommendations. Dr. Anthony Fauci, who is omnipresent now with his insight, etc. He's the director of the National Institute. He just this morning said masks should not be used as a substitute for social distancing, but rather can be used as a supplement. Because of some recent information that the virus can actually be spread even when people just speak as opposed to coughing or sneezing. The better part of valor is when you're out and can't maintain the 6-foot distance to wear some sort of facial covering. So he's saying again that it's not a substitute for social distancing, but it might not be a bad idea. And Sanjay Gupta, who again is all over the place, Dr. Gupta, he explained that masks could help people who have the virus but not have symptoms from spreading the virus. Way to think about this mask issue is that it's not really still for people who are not infected. So I'll say that again. The way to think about this mask issue is that it's not really still for people who are not infected. This is more for people who might be infected and don't know it, and to try and lower the likelihood that they will spread the virus to someone else. He stressed that social distancing is the best way to fight the spread of coronavirus. So, those are what the experts are saying today. I'm certain that many of you are educating yourself on this issue. I'm not going to, I guess I can give you some advice. I would say I wouldn't, but if you feel more comfortable wearing a mask, then you should. I mean, clearly there's no downsides. What I will say though is that Canterbury Woods does not have masks to give you. So, I've been talking about the mask issue for most of this week. Again, that continues to be an issue for us. On the positive positive side of that, you'll see more and more, every housekeeper now, when they are in your apartment cleaning or your patio home cleaning, they'll be wearing a mask. Every dining server, when they're serving you your lunch or your dinner, will be wearing a mask. And so we have more and more of the disposable masks, or not the disposable masks, I'm sorry, more and more of the washable masks, and those washable masks will have been handed out and will continue to be handed out to a majority of the staff in independent living. We have more washable masks coming in, and as they come in, we're going to be giving them out. So that's a positive thing. We are still hoarding masks on the healthcare side, for obvious reasons that I've stated throughout the last week or so, is that we don't know how many we're going to need from day to day, and we know how many we go through, but again, if we have positive cases over there, we're going to go through even more on a daily basis. So we're very protective of the disposable clinical masks that we have for the health center patients. Please also, for our independent residents, please don't ask the folks that are at the front desks of both places here and at Gate Circle who are taking temps. Please don't ask them for masks, even though they have them there for staff coming in. They're handing them out to staff as they come in, the clinical staff. Please don't ask them for masks because they're not allowed to give them to you. I would suggest that if you would feel more comfortable with a mask, people are making them, maybe your loved ones have the ability to drop some off to you at our front desk and we will get them to you, but we simply don't have enough to supply our residents at this point. If you have any questions or thoughts, I'd be happy to talk to anybody about that. I talked a little bit about the swab cleaning tests that we've been doing. So that has happened a couple of times in the health centers, and that has happened throughout independent living just yesterday. So basically what we're doing is we have a separate company coming in and swab testing multiple high-touch areas throughout the organization, both in the health center and independent living, to make sure that we are cleaning them appropriately to address the virus. And we will get those results back for independent tomorrow, I think, maybe later today. And so what it'll allow us to do is continue to really hone in on some of the areas that we need to do a better job. Shout out to Corinne, who's at the front desk here at Canterbury. Apparently, preliminary tests show that she has the cleanest desk area, workplace environment in the history of the world. I think that was the direct quote. If you know anything about Corinne, she's constantly cleaning something, has been forever, and so she was way ahead of the curve, so good for you, Corinne. Overall, COVID-19 testing, I can tell you that, I've had some residents say to staff or say to me, well, why don't we just get everybody tested? And I'll go back to what I said, it's not available. So the only people that can get tested are people that go through their primary care physician and are triaged through the Erie County Department of Health, and then they decide together who gets tested. That's just the way the system works. So you cannot, no matter what your age is, no matter technically who you are, you cannot just request to get tested and get tested. Believe me, and I said this before, if I could write a check today and have every single employee and resident tested at Canterbury Woods, I would do it today. But I can't do it. Maybe that day will come in the weeks ahead, but it's just simply not available right now. One other thing I want to touch upon, health center residents, and just some of the stuff that we're doing there. The health center residents are, unfortunately, both in the skilled nursing and assisted living, even more isolated than our independent residents, because not only can they not have any visitors, but only clinical staff can come in there and so on. So they have very little social interaction. So what we've done through the mandates and other opportunities is all of our health center residents either set up phone calls or FaceTime calls or Skype calls or Zoom calls with family members on an ongoing basis. I know that my father-in-law, for instance, talks to his family several times a week. The social workers and the staff down there set up specific communication time periods for the residents and their family members, and that's ongoing. And we're certainly appreciative of the staff for doing that, and we want to continue to help those residents that are in our health centers with maximizing those social interactions in a very difficult time. Also, our health center residents are actually monitored very, very closely for any signs. So their temperatures are taken every single shift. That's 3 times a day. And they're also monitored for any respiratory stress or anything that's abnormal within the respiratory system. They're doing oxygen testing and so on. So we've been doing that for a couple weeks. We were actually ahead of the curve on that, and we'll continue to do that again to continue to try to ensure that we're proactive with any signs and symptoms. That's all I had today. Don't hesitate to email me. It's rwallace@echa.org if you have any questions. Thanks, folks.